you guys.
Okay, hey, good afternoon, y'all. Thanks for coming. As usual, we're going to have some opening statements. Dr. Woodward, Dr. Jones, and Dr. Wilson. Then we'll have some time for some questions. Probably going to be holding this to about 30 minutes today. So get your most important questions in early. Alrighty, thank you. Dr. Woodward.
All right, good afternoon, everybody. Today, our count of COVID patients is 127, and I'm going to have to look at our sheet. I think, 26 pediatric patients, 101 adult patients. So that's the highest number we've had. It seems like every day for the last few days we've hit a new internal high on our own patients here with COVID, and we're watching the state numbers just like everybody else and seeing that those numbers are very high, either records or up there in our highest numbers of new cases. We've talked about what happens after the new cases. After a little bit of time, then the hospitalizations and the ICU admissions come. And we've also shared some information, both I think in press conferences as well as through social media, about the availability or occasionally lack of availability of any ICU beds. So we feel we are in the midst of a very serious situation. I know that you have probably all heard by now that we have been part of a request for some federal assistance. So working with the Department of Health and through MEMA, the governor's office, we've made a request. We have, along with a number of other entities, have made a request for federal help. And we were not sure what that would look like, if even we would be able to get any. We are glad that, in fact, yes, we have gotten the notification that we'll be getting some federal assistance in the way of manpower. What I have shared with you before is that our biggest pain point is some of our nursing and nursing staff availability. I think I told y'all probably a week ago that we've got a number of beds, both med-surg beds and ICU beds. These are adult beds that we are not able to open right now due to staffing, and through informal conversations with my friends around the state, there are a number of hospitals that are in that same position, that staffing is our biggest hurdle. So the assistance that we're going to get from the feds is related to staffing. And we are just learning today, as the day is unfolding, exactly what that team is going to look like that they are sending. The individual who kind of comes ahead of time to set up the operations arrived this morning. He and Dr. Wilson had been in communication and conversations most of the morning. And what we are planning to do is to deploy the field hospital into the basement of Garage B and to then utilize these additional personnel in that facility. As it turns out, we are getting some physicians, nurses, respiratory therapists, pharmacists. I will leave it to Dr. Jones and Dr. Wilson to speak more specifically about that, but we are getting some paramedics as well, some substantial assistance, and we want to make the best use of that we can to benefit the patients who need the assistance, as well as to benefit our own teams that are stretched very thin. So I believe that this afternoon the Department of Health is also having a press conference, and the governor has released some information via Twitter. So when it comes to the bigger picture of some of the federal assistance that we have requested, and that as a state that may be available, they are really the ones that can answer those questions. But we do have some information on what's going to happen here that we can share with you. We are hoping by Friday to be able to start seeing patients in that temporary facility. Let me pause there, and I'll ask Dr. Jones and Dr. Wilson if they would come forward and make some comments, and then we will be glad to take questions.
So since the pandemic, I think the thing that hospitals have feared the most is just total failure of the hospital system. And you know, if we track back a week or so, when we look at the case positivity rate, the number of new positives that we're seeing, the rate of the testing positives, and then the rate of hospitalizations based on what we are seeing, if we continue that trajectory within the next 5 to 7 to 10 days, I think we're going to see failure of the hospital system in Mississippi. I mean, hospitals are full from Memphis to Gulfport, Natchez to Meridian. Everything's full. You know, there's every day a little bit of movement here and there, and depending on where you take the snapshot, you know, you might see an open bed or two, but that's not the way it should be. There should be a continuous movement of patients such that we are able to compensate and have the ability to surge care for certain times that we need it. If there were, you know, school starting back, if there were a bus wreck of kids, we would not be able to take care of all those kids at this hospital. We're in a pretty serious situation. When you see federal teams come in, it really needs to, I think, open people's eyes to the fact that it is a serious situation. We're doing everything we can do internally to navigate our staffing challenges. We feel like we're getting to the place where we'll be almost to the point of being able to open our units, you know, pretty fully. We've maximized the amount of negative pressure that we can do, so that will be a maximum amount of COVID patients that we can take care of. So we're going to focus these federal assets towards COVID patients, both some monoclonal antibody, you know, some outpatient treatment, as well as some additional hospitalized or inpatient capacity treatments. But at the end of the day, we're not only faced with not being able to hire enough staff because so many staff members have you know, nurses have left the state, but today we have 70 hospital employees and another 20 clinic employees that are out on quarantine or have COVID. So our challenges are not necessarily that we haven't been able to, you know, keep somewhat of a pace up with what we need, but that we are also the victim of what everybody else is, and that is the fact that this virus is spreading around very rapidly. So we're hopeful that, you know, we can get people to wear masks and get vaccinated and kind of stay away from each other, and that this rapid rate of rise that we're seeing will peak or plateau pretty quickly here, so that we don't get into a situation where there is nowhere to transfer a patient at all, and we have to stop ambulances and some of the things that we just don't want to do as a system. I'm sure you've seen stories from around. Dr. Woodward was mentioning earlier that Grady Hospital went on total diversion yesterday. That is our nightmare. We do not want to do that, because we know when we do that, you know, not the COVID patients, but all the other patients, the heart attacks and the strokes and all these other things that we need to take care of that have time-sensitive care issues, we're not going to be able to take care of. And that's not what we got into health care for. So, you know, I hope people can just understand that it is a very serious situation. I don't want to say dire, and I don't want to say that we have reached the point of failure, but we are definitely headed that way if something doesn't change, and change quickly. I'll turn it over to Dr. Wilson.
Thank you, Dr. Jones. So as Dr. Woodward mentioned, we have been working with the Mississippi State Department of Health for quite some time throughout this whole pandemic, but that intensified in the last several weeks as we saw the need that we would be exhausting the resources that were here in the state. We would need external support. So the Department of Health has been working with MEMA and the Governor's Office, and we put forward a request for federal assistance. We anticipate that we will see a Disaster Medical Assistance Team, or DMAT, arrive here in the next day to 2 days, depending on when the flights come in. But we are deploying the state's mobile field hospital to our parking garage B, so that we have a field hospital that we can then use the DMAT staff in to take care of patients. We're looking at both mixture of inpatient beds and outpatient treatment bays. It'll be a little bit of a hybrid. Some of that will depend on the actual composition of the team when they get here, but we will have the field hospital deployed, ready to start running through and training tomorrow, and as Dr. Woodward said, hopefully have our first patient in there beginning on Friday morning.
Questions?
Yes, we're open for questions.
Yes, where are these doctors and medical personnel coming from? Because I've always heard, good Lord, it's hard to find anybody who can come help you guys out.
U.S. Health and Human Services. So these are federal employees. Best analogy is similar to the National Guard. So these clinicians have day jobs, but they're also part-time federal employees that can be activated by the federal government and deployed in times of disaster.
How many people can you treat in this mobile hospital?
A maximum is going to be 50, but that will decrease depending on acuity. Obviously, the higher acuity, the sicker the patients, then the fewer the patients will be able to treat.
You mentioned pediatric hospitalizations. Where is the capacity right now? How many more pediatric hospitalizations?
Sure. Dr. Jones.
So our pediatric hospital's full. We have 21 pediatric patients in the hospital today, 6 in the ICU, 4 on ventilators. Definitely the highest number that we've had through the entire pandemic. Boarding pediatric patients in our pediatric ER, I think about 10. So all of our hospitals are full. This asset that is being deployed potentially will be able to take care of some older teenagers, which may help some. But we are seeing a number, definitely more than we ever have before, of healthy children that are getting hospitalized with COVID.
The governor put out a tweet today, or a statement today, saying that we are at or near where we were in August of last year. Is that, could you give some perspective on where that stands for this hospital?
So for us, we have exceeded where we were last, at any point during this pandemic, actually, but compared to last August as well. So when you look at the numbers of the COVID patients that we have, certainly the proportion that is pediatrics, we personally here at this medical center, we are at a higher peak than we were.
How many people are going to be coming from federal?
The number of the team?
It can vary, but we anticipate that it will be between 30 and 35.
In the mobile hospital, what kind of patients will you all be treating in there?
Primarily what would be inpatient COVID positive patients, lower acuity, because obviously in the field hospital we're not going to have quite all the amenities we would have in the normal hospital bed, and then also the ability to do some monoclonal antibody therapies on an outpatient basis as well.
Will the setup be similar to what you had previously last year?
Yes, sir. Yes, sir. It'll be very similar to last year. We'll tweak it a little bit once the federal team gets here from HHS, and we can collaborate with their clinical leads to make sure that the footprint matches their operational needs.
Will the expiration of the state of emergency threaten any of UMMC's plans in the next couple of weeks?
So the answer, we're all looking at each other because part of the answer is we're not 100% sure. And we are trying to sort that out. It is certainly our hope that the state of emergency declaration by the governor will continue, but we are also working with Dr. Dobbs at the Department of Health at trying to understand exactly, if in case it doesn't, what that might mean. So we're not 100% sure.
We do have a federal declaration of emergency.
That's right.
Public health emergency.
Yeah, there's the overlay of the federal declaration of emergency, state of emergency, that offers some protection. So we're trying to sort out, in case the state one did not line up with the federal one, what that would look like exactly. Like I said, I'm hopeful that we don't have to tease all that out. That in fact it does continue.
Does 50 beds solve your problem, help a little bit, and provide some perspective?
And one thing I wanted to add to your question about where are these people from, as you know, I can't say 100% for sure because they're not here yet, and so many of your questions we can't answer definitively because we don't know exactly who's coming and exactly what they are and what they do, but it is certainly our understanding that none of them are Mississippians, that they are coming from other parts of the country. 50 beds would help us a whole lot for a long time. For the short term, and we expect this to be a couple of weeks that we have this particular team here, it will help a lot. But we also have to think about, okay, what are we going to do when their time is up? Is there a possibility to extend? You know, all of these things we just don't know yet. We've been in the planning phase all morning long asking ourselves these very same questions y'all are asking us. But no doubt about it, having these extra personnel and having the extra beds, yes, that is very helpful. I think your question was, does it solve our problem? I don't think it solves our big problem, but it is a big help.
That was going to be my question, was just in the grand scheme of things, and you talked about, Dr. Jones, that if the trajectory continues, possibility of the whole system.
That's right. So there are so many variables. You know, are we at the peak? Is it going to be another month before the actual peak happens and the peak of hospitalizations and the peak of ICU beds? We just don't know those things. We don't know what the impact of return to school, you know, we don't know what that's going to look like. Dr. Jones mentioned the day-to-day fluctuation that we have in our own team with people who happen to be out sick, and we can't predict that. So there are a lot of uncertainties that we just can't plan around. We just have to plan as best we can for what we can see on the runway that we can see. But no doubt about it, additional staff and additional places to take care of patients is a positive thing and definitely is a help.
If we proceed down this trajectory, as you said, towards the failure of the hospital system, what are the next steps in terms of systems of care, diversion, what will USDH do, what will UMMC do?
So, you know, the worst case scenario is what was just mentioned a minute ago about Grady Hospital in Atlanta, where they went on, they serve a role similar to us in the way of safety net function, trauma center, and those sorts of things. So, you know, what I saw, without knowing any details, just the headline that I saw was that they have gone on total diversion. So that's the place that we don't want to get to. You know, that is definitely for us what we see as, you know, really the big disaster. And we're doing everything we can do to prevent that. The fact that the systems of care is in place through the order by Dr. Dobbs to help around the state rationalize and organize the transfer of critical care patients and the very sick COVID patients is very helpful. I think that helps all of the hospitals. It helps us. It kind of helps with that planning. The piece that we really have a harder time in controlling are the patients that come in the front door through the emergency department. You know, that's unpredictable and can be quite variable, you know, from day to day and depending on what's going on. So it is certainly our hope that working with Dr. Dobbs and the rest of the hospitals in the state, with everybody else, that we don't get to that point. The biggest thing that will help us 2 weeks from now and 3 weeks from now and a month from now will be if we can encourage people to get out and get vaccinated. And when they're out, you know, in crowds and indoors in a crowded situation, that they wear masks. I mean, that's really the big answer. What will really help our problem is just getting more people vaccinated.
Is the percentage of unvaccinated patients here changed, increased, remained the same?
So just this, I would say, over the last few weeks, as this surge has happened with the Delta variant, what we have seen has been constant in that most of the patients that require admission and most of the patients in the ICU are unvaccinated. So that has not changed. What is good news in the world of vaccination is, in fact, that as you track to see how many people in Mississippi are getting vaccinated, comparing last week to a month ago or 6 weeks ago, that the numbers of people getting vaccinated has doubled or tripled even, you know, per week. So that's encouraging. it's encouraging to see more people seeking vaccination, and that is really what's going to help us get out of this.
Are we still north of 90% of the patients that are being admitted? 90, 93, I don't know yet.
The patients in the ICU, definitely north of 90% are unvaccinated, the patients in the ICU with COVID. The patients admitted, it's either 90% or high 80s, but
It's 90.
okay. Actually, this number's right in front of me, so let me. So that's right. So 90% unvaccinated. Yeah. So we've said this before, but it's worth saying again. The vaccine does not necessarily prevent you from getting the virus. It does go a long way toward that, but it certainly has a great track record for preventing getting really sick, needing to be hospitalized, and needing to be in an ICU.
You said that there were a number of staff members that were out with COVID or under quarantine. Is the lack of staffing, did that have anything to do with the mandate that came for employees to get vaccinated?
So that has I would say no. Yeah. The requirement that people are either vaccinated or wear an N95, we're in the process of implementing that and have not hit one of our deadlines yet. So we have not seen a loss of staff due to that. That doesn't mean we won't. I hope that we don't. But at this point in time, that's not a factor. It is just people getting sick or having family members that are sick.
What is the number one thing that people in Mississippi could do to prevent this surge from getting worse?
Get the vaccine. I mean, there is no doubt about it. The number one thing would be to get the vaccine. And until we get to a point where we're not in a surge, wear a mask.
In addition to the higher volume of patients you're seeing in the surge, with Delta infections, are you seeing patients needing to be hospitalized for longer periods of time as well as compared to the original strain of COVID?
So the major differences in what we're seeing now, the Delta patients versus the last year, the Alpha group, is they are younger and have fewer comorbid conditions. At this time last year, most of the patients we were seeing that were getting really sick were older patients. They were patients with other underlying illnesses. And with this variant, we are seeing younger patients, much younger in some cases, who are healthy. Healthy people are getting hit pretty hard with this. So that's the biggest difference in, before until now, as far as the patient demographic, really.
The message to Mississippians who maybe say, okay, well, they've got help on the way. Things are all better, COVID or not. If I need to go to the hospital, if I have a wreck, things will be better than what I've been hearing.
So this is not permanent. It is not permanent. We know that it will be helpful and will be additive to the system, and it is very positive, and we are really pleased. But it is not permanent, and it's really a Band-Aid. It's not the final answer. It's not really the big solution. The big solution is, let's get this surge under control, and let's get the spread of this virus under control, and the way that we do that is by getting people vaccinated. I mean, that is the big thing.
So for places like Neshoba County, they are completely out of bed. They don't have a lot of help there. And they were calling for help yesterday on Twitter. What does it mean for smaller rural places that can't see patients? And like Dr. Jones said, if something terrible happens, they can't take in trauma patients.
So they're in the position that none of us want to be, where there are people who acutely need your help, and you are simply maxed out and cannot provide that help. Through the Department of Health and MEMA and the governor's office, I know other entities, I don't know who they are, but I do know that other entities have requested assistance as well from the feds, and that may be forthcoming. I just don't know. So they may be able to also get some temporary help. Certainly us having some additional capacity gives us the ability to help others better. But the issue with Neshoba and other places like that is the demand outstrips the resources. And then that is technically the definition of a disaster, when demand outstrips resources, whatever they are. And that is, that really bad and dark place that we are all dreading and hoping, in fact, that we don't get to. Yeah.
What kind of retention do Mississippi schools have with regards to nursing as it affects this? Because it seems to me you have nursing programs at a number of community colleges. You have nursing programs here, you have nursing programs throughout the state, but you don't have enough nurses. So where's the answer? What type of retention do we have, if any?
So I don't know that number to tell you, but I know that we, along with all the other hospitals in the state, work hard to recruit the nurses that come out of our own nursing programs. We provide here clinical rotations not only for the students who are in our nursing school, but clinical rotations for the students in several other nursing programs around the state. And everybody who has exposure to these nursing students is working to recruit them, to join their facility. The issue is, so is everybody else in the country. So, right now they are in the driver's seat as opposed to us.
And that's what I was wondering, and I don't know the answer. What are you doing to try to retain these people who are probably burned out, and they're seeing other people being brought in and maybe being paid more?
So we are responsive to changes in the market when it comes to nursing pay. We are trying to be sure that people are not leaving us because somebody is paying more. However, when you look at some of these travel nursing positions, no doubt they are paying a lot more than the non-travel positions. So there are all kinds of tensions like that. We were just talking earlier about things that we can do to support the nurses and the nursing staff. It's an ongoing conversation to try to support them and to be sure that they know how valued they are, because they are the ones that minute by minute, day by day, are taking care of the patients. They're our most valuable resource. But it is an ongoing challenge.
And I wondered, do you start trying to schedule and make sure they have X amount of time off? What kind of perks could you offer with cash may not be the answer?
All of the above are things that we have talked about and considered and have under consideration. We've done things from providing snacks, to people so that they don't have to feel like they've got to leave the unit, just the things that make your day easier when you don't have to figure out how to get some food, providing meals, providing snacks, trying to meet what's happening in the market as far as hourly pay rate. I mean, it's a whole, there is no single answer. It's a whole host of things.
Last year, coronavirus was all across the nation, but now, because vaccines seem more concentrated in the Southeast, has it been easier to be competitive in the market now compared to last year?
It has not yet. We think we hope that some of the market forces will settle out across the country, but it is still a challenge. Yeah. Our number of ICU COVID positive patients?
24.
Is that adults?
24 adults.
Okay, 24 adults and 6 kids. 30 total.
We're going to wrap up here. Jonathan's got a few comments to make, and then we're going to wrap it up.
I did want to mention that the mobile field hospital and disaster medical assistance team that's coming into our parking garage will be a state resource. It'll be part of the system of care, so they will, it's not just a UMMC clinic or component, it will be part of the state's response and part of the state system of care.
So Medcom could direct a patient, say, from the Neshoba General to that building?
Correct.
What do we look out for in terms of anticipating, and as you warn this surge continues with point of failure, do we need to see the numbers dropping rapidly, or when are we locked in?
So there's not ideally we'd see the numbers dropping rapidly. Yes, that's the ideal state, the desired state. But, trying to stop the rapid rise of new cases trying to turn that around, to see these new case numbers going in the other direction. That's what we need to know that we'll be able to catch our breath and that the hospitalizations will slow down. Until we see those new case numbers stabilize and start to decline, we know that we're not around the corner yet.
Sarah, give you a chance for the last question if you have one. You good? All right. Thank you, everybody.